purpose of calling a separate press briefing before the actual event was because the subject that we are dealing with is actually very technical in nature. And
Sir, sorry for interruption. Just for recording purpose, your introduction. I know Mr. Yasin from GC.
Okay. I'm Yasin Chaudhary. I'm an IAS officer, 2015 batch. I'm currently MD NHM, Jammu and Kashmir. Audio is fine?
Yes, sir.
So usually we obviously keep on giving some press releases or the other, but the subject at hand was technical and it required some detailed expounding. So that's why we thought that we'd invite some people over and start talking about it so that we can build up, we can have some build up before the event. I'm sure that a week ago you would have followed this very important development in the health sector in J&K. That was the release of the SRS survey results. The SRS is the sample registration survey, which is conducted by a third party, a government mandated third party agency, to look into our leading health indicators. And I'm very, very proud to say that Jammu and Kashmir has dropped its IMR by a solid 3 points. It has come down to 17 points from 20 points, and this is the largest increase ever in the history of Jammu and Kashmir, and in fact the largest increase between two successive readings in the whole country ever. So this goes on to show that all these major developments that we have made in terms of in addition to our healthcare infrastructure, particularly maternal and pediatric infrastructure, has yielded results, and we are securing the lives of our neonates and infants. Now, before I go on about this, let me tell you a bit about what we have been planning. So, on 6th June, Jammu and Kashmir is going to host the first of its kind MCH Conclave, or Maternal and Child Health Conclave, which is basically a 2-day national level event, which will be in the format of a best practice sharing summit. So, we want to lead the country in bringing together all the leading maternal and pediatric experts, both from the tertiary care side, the clinical side, as well as the community health side, and also from the Ministry of Health and Family Welfare, as well as developmental organizations, multilateral organizations like WHO, Norway India Partnership Initiative, so on and so forth, and have an intense series of discussions, a series of panel discussions on the burning topics related to MCH here in J&K. So this was being planned well in advance for pretty much the last 6 months, but because and this IMR reduction news just happened to come, so we are very glad to leverage upon it and make J&K as the center of attention, or rather as a center of convergence for discussions regarding improvement in MCH care. Now, I'd like to lay some background. National Health Mission, its genesis was actually in this scheme called RCH, Reproductive and Child Health. The dozen other schemes were added later, but maternal and child health remain our core bread and butter, so as to say. The Janani Shishu Suraksha Yojana, Janani Suraksha Yojana, or the Rashtriya Bal Swasthya Karyakram. These have been, the age-old, schemes that have been running in NHM for the last more than a decade. And we have been building upon them, not just in a beneficiary-oriented scheme promotion manner, but also, as I said, in terms of infrastructure. And this is where I'm coming to. So, one instance or evidence that I want to lay out is the establishment of dedicated infant and neonatal care, or rather critical care units in the form of, say, SNCU, Special Newborn Care Units, or NICU, NICU, Newborn Intensive Care Unit, or PICU, Pediatric Intensive Care Unit, which NHM had been very arduously sponsoring and establishing in all the district hospitals, and even those which later got converted into GMC, and even the CHCs. And it is because of this infrastructure addition that we have been able to see more and more sick neonates not being referred and hence losing their lives in transit, and many other things. We are very proud to say that J&K UT, or NHM J&K, was one of the first state or UT state health societies in the country to establish all these units in a time-bound manner. I am also very glad to inform you, and a lot of you would have followed this particular event which took place in SMGS Hospital, Jammu, a couple of months ago. This was in regard to the ECRP package, the Emergency COVID Response Package, which is given by the Government of India, the Ministry of Health and Family Welfare, as a special dispensation to states and UTs to fight COVID through various means, be it say infrastructure support, HR support, drugs and diagnostics and whatnot. And as a part of it, particularly as a part of ECRP2 package, we got sanction for 42 maternal ICUs and pediatric ICUs. And the foundation stone of the same was laid by Honorable Lieutenant Governor Sir 2 months ago in SMGS. And I'm very proud to announce that all of those ICUs have been completed. They have been successfully constructed and are functioning, and will be inaugurated during the inaugural session, during the opening session of this MCH conclave in the morning of 6 June. These ICUs are all 20-bedded ICUs, and they are established in all the district hospitals. So the whole idea of specialized ICUs, I mean normal ICU every district hospital has some way or the other, but specialized ICUs for maternal and pediatric care were not existing, and this is the single biggest infrastructure addition in this subsector for the last decade, I would say.
Okay.
And now we can imagine or rather expect that our critical neonates would get intensive care treatment in Kupwara alone, in Kulgam alone, in Kishtwar or Punch, and would not have to be referred endlessly. A few other developments that I wish to add upon here. So this event was basically planned in collaboration with the Norway-India Partnership Initiative, which is a unique collaboration running between Government of India and Government of Norway. And in India, 3 states run this program, or were chosen to run this program, and these include Rajasthan, Chhattisgarh, and Jammu and Kashmir. NIPI has been associated with J&K for the last 7 years now, and their support has been critical in terms of, it has been very essential in terms of consultancy and monitoring and evaluation studies, which lead to course correction and proper implementation of our programs. We are also going to launch this special report called Situational Analysis of Maternal Health in Jammu and Kashmir, which is a very intensive study conducted over the last 3 to 4 years to actually analyze where we stand with respect to maternal health. Unlike IMR, MMR is not formally calculated. You might have heard that somewhere. So a lot of times we really don't have an idea about what is the exact situation. We do have certain instances of some pregnant lady dying on the way from, say, Shopian to Srinagar because she started hemorrhaging or had PPA, so on and so forth. But we actually don't have those figures that particularly. So this study is one first of its kind and is meant to show us exactly where we stand with regard to maternal health specifically. With regard to maternal health, there's one more focus area that we are laying emphasis upon. In fact, that's the first technical session that we are having, and that's regarding the high LSCS, exceptionally high LSCS rate in Jammu and Kashmir. I'm not sure if some of you were aware of this conversation that we started around a couple of weeks ago. I want to draw your attention to this serious issue of almost 42% of all the deliveries that are happening in J&K are cesarean sections. And in Kashmir division alone, that percentage is almost 60%. The standard WHO norm is 15%. So that means that out of the total, say, 100 babies were born, only 15 would require cesarean births. The others should be born through natural birth. But that's not the case. And what we have seen is a very perverse, push to encourage LSCS, and we can expect that out of, say, private hospitals because there's a monetary incentive for them there. But for government hospitals also, it is quite shocking and surprising. And we have evidence. There's been clear-cut, evidence established that babies born out of cesareans are actually weaker than those who are born out of natural birth. And there's also a very serious access issue here. There are very poor families who could have had a normal delivery, but are instead pushed to undertake a expensive cesarean costing 1 lakh or so in a private hospital or even elsewhere. So this is something which is growing out of hand, I believe, and that's why NHM J&K has decided to ring the alarm bells and take up this issue head on. We are in consultation with many of our stakeholders, and we have mandated the conduct of an LSCS audit. That is to say, actually analyze whether all the cesareans that took place were those of deliveries which actually needed a cesarean or not. For all the deliveries that have taken place in our government system. LSCS audit was not actually happening in J&K up until now, even though in many other states, particularly the southern states, it's a very leading practice. We have also set up some other ways and means, some mechanisms to promote natural birth. through initiatives like safe midwifery promotion for institutional births, as well as incentivizing the doctors and staff who undertake natural births, and so on and so forth. A few other things. This event will also see on the inaugural ceremony as well. This great, path-breaking development of a leading number of our labor rooms receiving the Lakshya certification. Lakshya stands for Labor Room Quality Assurance System, and it is basically a standard system for labor rooms. We are aware of the old age problem that labor room टूटा है, जो delivery table है, that is broken, light is not there, whatnot. So this is a standard system which NHM enforces, and we not just enforce it, we also equip those labor rooms to make sure that every woman will have a safe and dignified you should also, so in convergence or in say if we dovetail them with or coalesce them with the existing schemes like JSSK or PMSMA, you realize that all of this is coming together. So women, including free ambulance pick and drop under 102. And then finally, the Suman program is aimed at ensuring that all our women, all our mothers have a very dignified experience when they are going through this extremely important phase in their lives. So Lakshya certifications are going to, of course, ensure that we have the best of the quality, the state-of-the-art labor rooms, which will ensure this dignified deliveries to our mothers. A few other things that I want to share the focus area that we are dealing upon. So apart from a situational analysis and addressing the rising trend of cesareans, we want to talk about neonatal stabilization and pre-referral management. Because what we have found is that most of the neonates or infants who are dying, who are not surviving beyond a day or two or few weeks, are dying because of improper referral. And because it's extremely difficult and tricky and risky to transport a neonate than an adult. And that is why we have been so particular about establishing the NICUs, neonatal ICUs. Then we want to talk about maternal mortality as such, and the various reasons leading up to it. And this is also exposed, or rather not exposed, but let us know, make us aware of the shortcomings in our own. There will always be some regional specific reasons behind maternal mortality. Then we also want to address newborn health, long COVID. I'm sure you all know that COVID, while the pandemic is going on, is a limited issue, but we've seen people suffering from extremely long bouts of post-COVID syndrome. And this we want to analyze in the perspective of maternal and pediatric COVID. We also want to address early childhood care. That's one of the leading new hot topics, emerging topics in pediatric care, which is shifting the focus on how child rearing starts while it is a fetus to the point where its age is up to 1,000 years, is extremely crucial and detrimental in determining that individual's success, life expectancy, well-being during the whole life. So that's the focus we're going to shift. We're obviously building